Yes, I'm a physio at Fit As A Physio. These are some taping techniques I use to prevent and treat injuries.
Patello femoral, sit back down for me, Stephen. How are we going to tape for a patello femoral pain or patello femoral irritation?
Lateral to medial.
What are we trying to correct?
The lateral tracking.
Most of the time, lateral tracking. So you want to have a feel for where their patella sits. Does it sit high? Does it sit low? Is it sort of laterally sort of sitting off to the side? Is it sort of laterally tilted where his lateral border's dropped in and his medial border sticks up? Is it rotated around? Slightly have a look at how his patella tracks. So if you push down onto the bed for me, does it track straight? Does it track laterally? Relax, do that a couple of times. Have a bit of a poke around his patella. Most of the guys that have this sort of taping will probably have been to a clinic and seen physio, and this is sort of included in their rehab most of the time. You can also just pop that inferior border pole up out of the fat pad, so rather than squashing it down where it can be quite uncomfortable, just pop it up. So even just some tape on the sort of superior surface can help pop it up, take some pressure off the fat pad. So there's lots of different ways you can play around with it, depending on what the complaints are: stairs, squats, lunges. Most of the time you'll probably use some light fix or some Fixamol underneath, because it generally sticks on a little bit better. So where are we going to start our tape? Outside of the knee. Why?
Because that's usually where it tracks wrongly.
Yep, so we're pretty much going from lateral to medial most of the time. Very rarely will you tape someone going from medial to lateral. It does happen.
You try and grab onto the hammy tendons at the back?
Yes, I'm just using my biceps fem and my medial hammies as a bit of an anchor. Use the corners of your limbs, and that's true with all the limbs. So if there's tape on a flat part of the surface, it's going to pull off, yeah? If it's on a corner, it's got a little bit more grab. So it's got a little bit more to hang on to. So you use the corners of the body to grab onto. So you should technically be over patella, okay? So if you need to put a pen marker on the superior pole and the inferior pole and go across, then do that. And that's sometimes how I get patients to do it at home. So just lay the tape on laterally, go about 3/4 of the way around, tear it off, and then you've got the tape then to play with. And then you can move your patella. You can glide it medially, you can tilt it medially, you can, if you want to rotate it, you can. But then you can play around and have a little skin fold on the inside. So it's short on the inside, longer on the outside. Have your kneecap tracking that way. But I'll be playing around with that. I've gone probably a little bit too low there.
Do you find this is more for the clinic than the footy field?
Generally more rehab, but a couple of guys will come with patello femoral pain, and you might do a light one and then overwrap them for a game. Because if they play in a game situation, that's going to peel off. So normally I'd lightly wrap them around the back.
It's hard for them to get into deep flexion and it pops off.
But you need to play around with that. There's probably no quick fix for the patellofemorals. It's a tilt, it's a glide, it's a rotate, it's playing around with what works for them. Reassess, squat, lunge, jump, see what works for the patient.